Hi everybody, my name is Michelle Wadsworth and this is my teaching for the underserved community. This is a population level health education intervention presentation through California State University, San Marcos. To give a little background and significance, the two topics that I will be presenting about will be the two teachings I did in my underserved community of Antioch, California, on topics of obesity and heart disease. Obesity in the United States, the percentage of children and adolescents affected by obesity has more than tripled since the 1970s. Data from the 2015 to 2016 show that nearly 1 in 5 school-aged children and young people ages 6 to 19 years in the United States has obesity. Children usually live a more active lifestyle than the rest of the population in the world, yet 1 in 4 fifth graders in the Contra Costa County, which is where Antioch resides, are overweight or obese. Heart disease, about 610,000 people die of heart disease in the United States every year. That's 1 in every 4 deaths. Heart disease accounted for 22.7% of all deaths in Contra Costa, making it the second leading cause of death in the county. Health-related problems. I presented to 2 different groups. One group was a youth population of elementary students going to Sutter Elementary in Antioch, and another group was an elderly population of adult males that attend a weekly Bible study in Antioch as well. Group A, the problem that I will be attacking or addressing is the prevalence of childhood obesity that not only affects Antioch but nationwide as well. I will also be attacking the lack of exercise and the increase in sedentary lifestyles of children. For Group B, I will be touching on the topics of prevalence of heart disease in the elderly and also the lack of adequate monitoring, prevention, and education. Healthy People 2020. Healthy People 2020 aims to reach 4 achieving goals. It is to attain high quality, longer lives, free of preventable diseases, disability, injury, and premature death. The goal is to achieve health equality, eliminate disparities, and improve the health of all groups. It's to create social and physical environments that promote good for all. That is the goal of Healthy People, and it's to attain it by the year 2020. So according to the Healthy People 2020, their goal in regards to nutrition and weight status is to promote health and reduce chronic disease risk through the consumption of healthful diets and achievement and maintenance of healthy body weights. It is also another goal for heart disease set by the Healthy People 2020 is to improve cardiovascular health and the quality of life through prevention, detection, and treatment of risk factors for heart attacks and stroke. Early identification and treatment of heart attacks and strokes, prevention of repeated cardiovascular events, and reduction in deaths from cardiovascular disease. Needs assessment. Group A, the youth population, with the aid of the windshield survey driving around through Antioch, I was able to identify obese children, and later on through some research came across the prevalence of obesity in school-aged children in Antioch, California, in Contra Costa County, and as well as the U.S. as a whole. For Group B, the elderly population, I noticed a group of elderly men meeting regularly at a public restaurant ordering unhealthy food choices during their Bible study. Theoretical framework that I used is the Precede-Proceed model. Precede stands for predisposing, reinforcing, and enabling constructs in educational, environmental diagnoses, and evaluation. As its name implies, it represents the process that precedes or leads up to an intervention. The precede portion of the model consists of 4 phases, phases 1 through 4. Proceed spells out policy, regulatory, organizational constructs, and educational and environmental development, and true to its name as well, describes how to proceed with the intervention itself. Proceed model consists of the last 4 phases, phases 4 through 8. Phase 1, defining ultimate outcome. The ultimate outcome for the childhood community is to reduce the prevalence of obesity. For the older community, the ultimate outcome is to want to overcome cardiac disease through prevention. Phase 2, identifying the issue. Kids and adults, and adult males, were identified as having sedentary lifestyles, lack of exercise and education, as well as poor nutrition choices. eating habits, and even stressful environments. Phase 3, factors that influence. So there are genetic factors that influence diseases and how our body takes on those diseases, such as obesity and hereditary heart problems. These things we cannot change, but there are other modifiable factors that we can change, such as exercise, healthy food choices, and elimination of addiction. Phase 4, identifying best practices. Teaching used to be is the means that I chose, and it's an effective practice for the young as well as the elderly community to emphasize the importance of daily activity for healthy BMI and for heart cardiovascular health, and to reinforce that. Phase 5 is implementation. A Thursday was set for teaching elementary school kids grades 1 through 5 during their after-school program at Sutter Elementary School called Kids Club. The other implementation that I did was a teaching was arranged through an elderly gentleman's Bible study to teach them about heart disease. Phase 6 is the process evaluation. I developed an education curriculum for each health issue that by mid-November 2018 with plans to implement teaching classes on each community. Phase 7 is the impact evaluation. This is where I was able to write up 5 trivia questions to ask the children to see if the information that I taught was actually retained, as well as asking them about the 5 different food groups to name. I was also able to talk to adults and getting them to take a little blood pressure reading card to have handy with them in their wallet, and to give reasons as to why they would want to live a healthy lifestyle. Phase 8 is the outcome evaluation, and that is seeing that the kids' body mass index for Sutter Elementary School would be within a normal and healthy range, and that male adults would have follow-up appointments with their doctors in order to prevent and catch early on any kind of heart disease. Issues and barriers that I came across. Barriers is that it's difficult to change old habits, routines, and customs. It's also difficult to implement healthy lifestyle choices if parents are not involved or educated correctly or with the same information that the children are. Also, some can't afford medical screening or blood pressure cuffs to have at home, so that's kind of hard to teach them to monitor their own blood pressure at home if they don't have that ability. Another barrier is lack of access to healthy food choices, albeit environmental or financial. Another barrier as well is change can be stressful and threatening, which is many times often why people don't like change. An asset, though, is that people are capable of change. Positive reinforcements help that and to continue to reinforce that. After school programs implement active games. So the Kids Club, I noticed before and after the teaching, they have some kind of fun activity or relays for the kids to run around and to burn off some energy. Another asset is education can be done to inform the population and perceive benefits and incentives to change, as well as social support through religious gatherings that teach self-care that align with their religious beliefs. Interventions, the actual teaching that I did for the older community, for the gentleman, I ended up printing a business size card with information as to what the normal blood pressure range is, scaling all the way up to critical, so that they can have those numbers written down, since that'll be hard to remember and to retain, especially given that people have forgotten 50% of the information you present, and within 24 hours, they have forgotten an average of 70% of new information, and within a week, forgetting claims of an average of 90% of it. So having this card handy, somewhere in their wallet, somewhere easy to reach, is something that they can easily reference. For the kids, my main objective, my main goal with the teaching was to provide something that can incorporate all visual, auditory, and kinesthetic learning. I made a poster board that had big visuals that touched on the 5 key points that I wanted to teach them, and it was also there for their reference in case when I asked them the questions, they can look back on it and kind of re-emphasize that what I was trying to have them take home. Educational techniques and formats for kids must be interactive in order to keep them engaged and intrigued. The 5 main points of my poster was a Bible verse to help incorporate what they're already being taught in the after-school program, which is the 1 Corinthians 6:19-20. Talks about how that we are not our own, that we are a body purchased by God, and that we are to take care of it. And taking care of it looks something like eating healthy, teaching them about the 5 food groups, as well as reinforcing 60 minutes of exercise a day, and teaching them how water is the most crucial thing that they can drink over any kind of sugary drink or soda. And I also explained to them what a calorie was, that it's a measurement of energy. I explained it in very simple terms, and I even made it in reference to money. So I had cut out some fake, dollar bills to kind of show them and get their attention, and explain to them, if I have X amount of money to spend during the day, don't I want to spend it wisely so I can actually get more? And that's the teaching that I tied in with foods, and how healthy foods actually have lower calories and are more beneficial for your body. Budget and logistics. I had to do some purchases for this teaching. I had to purchase a poster board, paper fillers, bouncy balls, frisbees, jump ropes, just all things I got at the dollar store, nothing terribly expensive. But the average annual pay for a community health nurse across the U.S. is about $67,000, which averages about $32 an hour if a nurse were to come in to do such a teaching. Evaluation and outcome, I had short-term goals and objectives. I had that the children would be able to state 5 questions correctly, which they were able to. That they would also be able to name 3 of the 5 food groups, which that goal was met. That for the male population, that they were able to agree to keep that card as a reference, which they agreed, and that they were able to name reasons why they would want to continue being healthy, which that was also met. Long-term goals, is for the Sutter students' elementary BMI index would be within range by the end of 2019, and that within 6 months of the presentation for the elderly population, that they would agree to set a doctor's appointment for follow-up and checkup. Results and conclusions. Weakness in my project poster board was hard to see for children in the back, as well as it kept sliding down to my presentation, so I had to keep holding it up. And the blood pressure cuff was only a one-size-fits-all, which is difficult when we have different body ranges. What I would do differently for next time, I would do a PowerPoint presentation for the kids, and I would implement maybe some walking with my teaching before or after, or maybe even during my presentation for the adult community. These are my references, and thank you for listening to my presentation.